Hello, my name is Jamie Schauer, and I'd like to welcome everybody to our first of our webinar series that's addressing air quality management and monitoring. This is the first of the series, and we're hoping that there'll be a webinar every month for the rest of the year. And so, first of all, I'd like to just introduce a little bit about the background of where it brings us to this point. We have two projects that are funded by the U.S. Department of State, and I'll mention that on the next slide. And that they deal with about air quality monitoring and management. And what this webinar series is part of that project, and we'll be talking more about the project and some of our goals in future webinars. But for right now, I really just want to focus on what we're doing for the webinars. And I want to first start out by introducing the four sort of organizers of this. Again, my name is Jamie Schauer, and I'm a faculty member at the University of Wisconsin. Professor Bergin is at Duke University and will be actually our speaker today. Professor Salam is from Dhaka University and will be helping as a panelist today and helping with asking questions and answering questions. And finally, Professor Chatterjee from the Bose Institute in Kolkata is part of our project team, and he's going to alternate participating as one of the co-hosts with me as time goes on. So in the webinar in March, he will also be joining us as co-hosting this webinar. So I want to start out by just saying is that this work, the disclaimer and acknowledgement, is funded by the United States Department of State to projects for the University of Wisconsin, Duke University. I just want to be clear that these are kind of our understandings and our opinions and not necessarily that of the State Department, even though they're funding the project. I've listed here two of the grants that are helping to make this possible, and that we will be providing more information about the project website and the webinar website, which I'll mention at the end. But as I said before, we're recording this, and we will be posting that on for people to watch who are unable to attend. And again, I want to just emphasize the partnerships with the U.S. Embassy in Bangladesh, in Daca, and the U.S. Consulate General in Kolkata. And as I mentioned before, our sort of academic partners are Dhaka University and the Bose Institute in Kolkata. Just a couple of quick things before we start the lecture. In this webinar format that we're using, all of the participants are muted, and they're both their video and their audio, so they cannot speak and will not be seen. Along those lines, we're recording this. And the recording will be posted online. If participants would like to ask questions, we've disabled the chat function, so there is no chat box. But we have the Q&A, and so at any time you can post your questions in the question box. And what happens is after the lecture, we will spend about somewhere between 50 and 25 minutes just answering questions or having a dialogue about things that are important. If we're unable to answer all the questions, we will provide a written response after the webinar that will be posted on the website as well. So again, the format is that we're going to have a 30-minute talk from Dr. Bergin, and then we're going to go ahead and open up the questions, and Professor Salam and I will sort of facilitate those discussions going forward. Okay, so with that, I'd like to introduce Professor Bergin, who's one of our main collaborators on this effort. And Professor Bergin is going to talk about establishing some planning and vision of why we're doing monitoring and what that means for air quality management. So, Mike?
Sure. Yep. Okay. Well, thanks, Jamie. And as Jamie said, I'm a professor of environmental engineering at Duke University, and I'd like to talk about air quality monitoring and some of the goals and strategies of air quality monitoring and some of the key components that need to be considered when doing air quality monitoring. So can we go to the next slide, Jamie? Okay, so there's lots of air quality monitoring methods, as everybody knows. I think this upper left corner, that is your typical air quality monitoring station. This would be a regulatory station. And as you see, there's kind of an enclosure there. That enclosure is very carefully maintained indoors. The bottom left would be some of the instruments that might be located in that enclosure. You can see the BAM instrument, or the instrument that measures PM 2.5 there on the left, and the other instrument to measure ozone. And we'll come back to this and discuss this, but these are often pretty costly instruments that require lots of maintenance and oversight. At the upper right corner is sort of an emerging trend in what's going on with air quality sensors. These are a multitude of low-cost air quality sensors that you see there. These things range from being homemade and maybe costing in parts $10 to $15 to maybe hundreds of dollars in this case. And we'll discuss this as everyone knows. There's a lot of excitement about these instruments, but a lot of questions as well. And then in the lower right-hand panel, you see there's also lots of remote sensing methods that can be used to sense air quality. This is just an example of a few. And these things are in some sense very exciting because you can get global coverage of air quality, but then again, there's lots of issues with them depending on what question you're trying to answer. There's uncertainty involved in them, and sometimes they don't cover they don't give you good time series at given locations. So could we go to the next slide, Jamie? Okay, so as mentioned, there's many different air quality monitoring tools. I think that first slide gave you an idea of all the different options. And I think that it's often very difficult to choose an air quality monitoring instrument. I know that many of us who are air quality experts get asked questions all the time by a wide range of stakeholders and collaborators about what would be the best way to measure pollutants. And I think it really depends on what you're trying to measure, what pollutant you're trying to measure. There's time averaging issues. Sometimes instruments can give 1 second, sometimes 1 millisecond data, and sometimes it's only 24-hour data that you can get. And again, it depends on the methodology and the question you're trying to answer. There's all sorts of different sensitivities with instruments. As you can imagine, the regulatory instruments are typically relatively sensitive, and the low-cost instruments are not. So I think the sensitivity is an issue, and I think we always have to worry about the accuracy and precision needed for the measurements. And certainly we know that as measurements get more accurate and precise, they get more expensive. There's also tools such as offline methods, and these methods include filter sampling. And again, I think it depends on what question you're trying to answer, what method you might choose. Increasingly, as you can imagine, the data processing becomes a tremendous issue. In fact, when it comes to some of these low-cost sensors that potentially give data every minute, and maybe you have 100 of these sensors set up, that's a lot of data. And it turns out that often the data processing is a rate-limiting step, and sometimes it's very, very, very complicated. And I'll discuss that in brief detail, and also we'll be discussing that in later webinars. And lastly, as I alluded to, and we'll talk a little bit about this later in the talk, the costs, the capital costs, the upfront cost for some of these instruments is pretty expensive. Maybe some of the regulatory instruments cost on the order of tens of thousands of dollars. But the maintenance and service on these instruments, if you lump in everything involved between personnel and maintaining or even buying structure and infrastructure, can be hundreds of thousands of dollars a year. So there's lots of options and lots of things to consider when trying to choose the proper air quality monitoring tool. So can you go to the next slide, Jamie? Okay, so I think as I alluded to, when you're doing air quality monitoring, I think you really have to think deeply about what your goals are. So for example, for compliance with regulation, and we're going to talk about these in slides that will come. Obviously, compliance with regulation, these have to be of very specific precision and accuracy. For health risk and assessment, we'll talk a little bit about that. Sometimes annual average rough estimates are good to just get a ballpark estimate of health effects. Maybe they don't have to be as precise and accurate as they do when it comes to regulations. For source attribution, I think this is a whole different kind of monitoring, and as I'll discuss later in this talk, there's some really exciting methodologies that we think can be used for source attribution that are emerging. Trend analysis, I think, of course, it depends on what you believe the decrease in the concentrations are, and you have to have measurements that are accurate and precise enough to be able to detect what you believe the change will be. And we'll also talk a little bit about research. There's all sorts of emerging tools for research. Some of these tools are highly sensitive and highly specific. And I think if your air monitoring goals are to measure something very highly precise and perhaps look at the mechanisms of the formation of these specific air pollutants, then there's sometimes very expensive research tools that can be used. And lastly, what we'll talk about and what is also part of the projects that Jamie talked about, State Department projects, is if your goals are to interact with the public and outreach and engagement, for example, then maybe you don't need as precise and accurate measurements, and maybe some of these low-cost methodologies will work well. And we're going to talk about that at the very end of this talk. Okay, can you go to the next slide, Jamie? Okay, so I did mention, so the first thing we talked about in the previous slide was if your monitoring goals are for regulations. And I think one thing, when it comes to regulatory standards, I think you have to have very, very strict measurements that are very well defined in accuracy and precision, because of course there are legal implications. If the concentrations, for example, are higher than expected, then there's legal implications, and those measurements have to hold up and be very robust. And so I think they typically, there's very well defined monitoring methods, and often there's a lot of paperwork associated with these. This is quality assurance plans, quality control plans. And of course, I think these sites have to be very carefully chosen. I think that these tend to be, as I mentioned, these tend to be what we envision as the highest cost of making measurements. These make measurements for regulations. And I think, for example, the U.S. State Department makes some very regulatory sort of measurements at the consulates and the embassies. And, I think the State Department could attest that this was not a simple task to make these measurements, to set up the measurements and make these measurements robust and report high quality measurements. And, lastly, of course, making these measurements, transparency is very, very important. And all the methodologies have to be very well spelled out and understood. Can we go to the next slide, Jamie? Yeah. So I mentioned this already, but as I said, and I kind of said this, I've said this several times, and it's something that I think is an important thing to point out, is these measurements are typically very expensive. And I think sometimes the measurements perhaps don't look that expensive. Maybe the BAM monitor costs $15,000 or $20,000, but by the time you get it set up properly, it might be over $100,000, and then you have to have very skilled technical people maintaining these measurements. But as I'll talk about a little bit later, despite the fact we would like to try to get away from these reference monitors because of their cost and care, I think that these monitors are always going to be necessary. And as I'll talk about later, these monitors might serve a key role in calibration and verification of low-cost sensors that will augment these reference monitors in the future. Okay, can we go to the next slide, Jamie? Okay, so I'll also, as I said, we're breaking down what we talked about were some of the goals, and health and risk assessment is another goal of monitoring. And as we know, and I'll talk about this in the next slide, the health impact of air pollution is relatively large. We tend to think mostly about particulate matter, and if you look at the recent literature and things like the global burden of disease, particulate matter is the leading air pollution cause of death. And so typically these have been done with annual averages, and they're annual averages over often relatively large regions. And as we know, there's lots of variability within regions, but they tend to be annual averages, and sometimes there's ground level PM2.5 concentrations. Not all that often do we have regulatory level PM2.5 values on the ground. There's also satellites that are used to estimate these fine particulate matter PM2.5 concentrations. And as I'll talk about in a minute, these tend to have some substantial uncertainty to them. And I think, why don't we leave it at that? And with the notion of uncertainty, go to the next couple slides, Jamie. Can we go to the next slide? Okay, so this is so we've heard the global burden of disease. That was basically what that did is it took mostly household air pollution, estimated health impacts, and maybe on the order of 4 million people a year dying from air pollution. If we look at this sort of upper right panel, what this study did is it actually took response functions for outdoor air and how outdoor air affects people's health. And it took studies of the relationship between outdoor air pollution and health outcomes. And so you look, there's a hazard ratio. That's sort of the, so you look PM2.5, upper right panel hazard ratio. And that hazard ratio is sort of the increased number of deaths due to PM2.5. First of all, this is with this model presented in this paper with outdoor air. And there's a pretty big envelope, as you see, a gray zone. So there's some uncertainty with any given model. Okay, this model certainly goes from 1.4 to 1.8 to 1.9 for the hazard ratio, sort of at the upper end at 80 micrograms per cubic meter. But if you look at that panel on the left, and I won't talk too much about the details of this panel, but the x-axis is basically the mortality rate estimated from a model like the global burden of disease, and the y-axis is the model used with the outdoor air response function for health. And that you see that one-to-one line, and if you look at the blue and red dots, basically sort of if you use the outdoor air model, you get almost a factor of 2 increase in mortality. So I think the thing that I want to say is, even though we would love to have this understanding of exactly what the response is to exposure to PM 2.5, even the models currently have about a factor of 2 difference in the mortality rates. But certainly all the models say that as PM 2.5 goes up, the mortality goes up as well. Okay, and maybe that's not surprising. Can we go to the next slide, Jamie? And so what this is sort of the global air quality exposure relevant health impacts, and these are relative to one another globally. So if you look, you can see sort of the United States, North America, that's blue. It says 3.6. If you just remember that number, you go over towards India and Bangladesh and areas like that, it's about between 50 and 80. So what that means is there's a much higher exposure to air pollution and health effects in these regions, and maybe that's not surprising. So huge spatial difference, but also if you look at there's pretty broad areas that are colored in. We are pretty sure we know the concentration in these areas, but I think it would be nice to know, get some validations in these areas, because a lot of this is based on satellite measurements, and there's very few of these regulatory monitors around the world. And it points to the need to do better measurements, spatial measurements of fine particulate matter exposure. It's probably not going to change that much relative globally, because the places with poor air quality still have poor air quality, no matter how you measure it, and places with like the US and parts of Europe with low air quality are going to stay low. But I think we need better estimates and verifications of the air quality in these locations. But again, these are highly uncertain, and if you think about it, you've got uncertainty from the response function of exposure. I just showed you that could be a factor of 2, could be more. And then we have a broad range of concentrations across the globe, and highly uncertain concentrations due to our lack of monitoring in lots of locations. The big picture probably won't change, but there's some specifics of the air quality in these regions that I think we need to better understand. And lastly, as I said about monitoring and time series, and I'll say something about that in a minute, I think we need to really start establishing time series of measurements so that as we develop mitigation strategies, we can verify that our strategies are actually working and decreasing exposure in these countries. Okay, can we go to the next slide, Jamie? One thing that has been very powerful is, and one of the goals often of air quality monitoring, is source apportionment. And I think Jamie, who's on this call, is one of the world's leading experts in source apportionment, has done a lot of work in this. And of course, what that is trying to understand what the very specific sources are of pollutants reaching any location. But also trying to understand where not only what the sources are, but where the sources are coming from. And these measurements are really important, because I think when we develop mitigation strategies, we have to focus on which sources are contributing to air quality. And also, these source apportionment studies are typically coupled with modeling, and we inform the modeling what the sources are. You're allowed to do sensitivity studies with the modeling. For example, if you're in a location and you realize that transportation-related sources are the ones that are the most important to affecting air quality, you can use the models to change the emissions of the transportation sources to see how they affect air pollution, and then further how they affect health. And as I mentioned and alluded to, there's also some new methodologies where you can integrate meteorology with on-the-ground measurements. So this might be something like low-cost sensor networks and regulatory monitors. You can integrate that with meteorology, and you can get an idea of where the pollutants are coming from reaching your source. And I think this is a very powerful tool to start focusing on sources and source regions for mitigation strategies. Can we go to the next slide, Jamie? Okay, so I just want, as I mentioned, there's this idea of collecting filters. And if your goal is to do source apportionment and figure out very specific sources, you can collect filters, and you can do some relatively complicated analyses of these filters to look at very specific chemical compounds. And this is an example of doing this, measuring chemical compounds. And this is in Fresno, California, but you see the date there and concentration. And this is the concentration due to biomass burning, the contribution of biomass burning. There's very specific tracers for biomass burning. And you see that these two different methods, these two different models that you can put your information into about the filters show very similar results. And so one thing is these have been very, very powerful tools, and I think they're important to use in source apportionment studies. But also I should note that as it turns out, they're actually pretty costly, and there's not a lot of people in the world who have the capabilities to do these sophisticated, moderately sophisticated chemical measurements. Can we go to the next slide? Okay, so as I alluded to, so one way is you collect filters. This is sort of the meteorology method that I was mentioning. And if you look, these are two spots in California. And let's just look up at the top left panel, and those are, it says clusters, but what you can do is you can take local meteorology and you can run models. Then you can figure out for any given location, these dots are the locations where the air was coming from reaching that location. And the reason this is powerful is you kind of see, like if you look at cluster 1 upper left panel, Fresno, you can kind of see that air is kind of coming from the northwest. And then you might look down at the bottom right cluster for the Fresno there, and you see that the air is coming kind of from a more southerly location. So this helps you understand the source regions. And the notion is that when as we develop more regulatory monitors, but even as we are able to put more sensors that we trust in and around this location, we're going to collectively get an excellent idea, or you can collectively get an excellent idea where the sources of the air pollutants are. And so this is kind of an emerging methodology, and a methodology that we're going to apply to the State Department projects, and I think others are going to apply in the future with these low-cost sensor networks to better understand sources and source regions. Can we go to the next slide, Jamie? Okay, and also, as I mentioned, we looked at that map of the sort of exposure-relevant concentrations and health impacts across the globe, and we said you see some places it's very low, some places very high. And then what I mentioned is that part of these measurements, the importance of these measurements is to figure out as we develop mitigation strategies, how well these mitigation strategies really work. And so these measurements hold great promise in doing trend analysis in very specific regions. And I think the trend analysis is critical, again, for the mitigation strategies. And one thing I want to say is that I think we have to develop very robust methods for these trend analysis for the sensors we use. And we have to, again, coming back to the regulatory monitors, I think not only we understand the regulatory monitors pretty well, they're very expensive. I don't think that these regulatory monitors within themselves are going to help us answer what's happening, what the trends are going on in these locations. I think a combination of those with the low-cost sensors, and I think those sensors, we have to well understand how well they're working. And of course, again, the reason we're going to always have to have some baseline of these regulatory monitors is I think anything that is involved in regulation and policy is going to have to be very accurate and precise and very well understood. And at this time, I think the low-cost sensors are not, I would say, for the most part. Okay, can we go to the next slide, Jamie? So for example, this is just an example of the trend analysis within the United States. And you kind of, this goes from about 1999 to I think about 2015. And what's really interesting is these are a bunch of different regions. And this is just showing the success that we've had in the US with diminishing our PM 2.5 concentrations. It's really interesting. And of course, these are a lot of different regions. And so it's very, very clear that strategies to, for example, reduce emissions from coal-fired power plants and mobile sources have worked very well throughout most of the US. And in fact, you can see that we've met the standard. In fact, that's 12 micrograms per cubic meter. But I would say, as we move on, I think what we would like to do is, it'd be great if we could build capacity and all work together to for all the countries that have poor air quality to begin to track their pollution with time, just like this, so we can figure out if mitigation strategies are properly working. Can we go to the next slide, Jamie? One thing I don't want to say a real lot about this, but as I said, if research is your objective, there are many, many possibilities available. This upper left, shows sort of like the combination of low-cost sensors, mobile monitoring in vehicles, and satellites. On the right, as you may know, there's been some very sophisticated measurements. This is a car. In this case, there have been measurements made at various locations in the US, including San Francisco, and you've probably read about this with the Google car. And often these cars are instrumented with hundreds of thousands of dollars in instruments, and it's very costly, but you can get very, very specific concentration profiles throughout cities and spatial distributions of concentrations. If you look at the bottom right, there's also sort of these new emerging techniques using mass spectrometers, and these have been emerging probably over the last 15 years or so, and they're very expensive instruments, but on the left shows you an example of the information they might get with time. These gives very specific chemical compositions that can be tied to very specific sources over time. These are kind of research grades instruments, and they tend to augment studies to look at source apportionment, but it depends on your specific goals, but they're very expensive, but they can be very useful. And I think more and more though, these things are not ubiquitous. And as I mentioned, throughout the world, we don't have a lot of regulatory monitors, so these types of measurements are still pretty rare. Can we go to the next slide, Jamie? Okay, so the last thing I want to talk about, and which is a big part of trying to understand air pollution and make air pollution or mitigate air pollution, make air pollution better, is engaging with communities who are exposed to higher pollution concentrations. And I think there's a lot of emerging information about this. I think maybe to some extent we still don't well understand how to engage with communities of all different kinds of communities, but there's a lot of existing tools that I think are going to begin making these engagements happen and happen in a fruitful way. And of course, as part of the State Department projects, this is an important aspect of them. And can you go to the next slide, Jamie? So for example, over the last 5 years, there's been explosive growth of these low-cost sensors, like I said. And of course, these, I'm showing some sensors that we made in my lab, but basically the upper right panel is some sensors to measure things like NO, NO2, and ozone. And CO2 is also in there, and PM 2.5. Collectively, that's about $200 worth of equipment. If you get those for regulatory monitors, it's probably going to be on the order of $100,000 worth of equipment. And then you can package these things like in this box or in these. So we've also, like a lot of people are doing, we've made these into personal exposure monitors. Can we go to the next slide, Jamie? Oh, yeah. And one up from that. Yeah, perfect. Thank you. So, what's real interesting is these are actually our commercially available instruments. These the instruments you're seeing are mostly for PM 2.5. Some of them have gas sensors. So not only you saw that first slide up top at the beginning, and you saw a table full of all sorts of different looking sensors, from ones that are maybe slapped together to more commercially available ones. These are commercially available ones now. These things, lots of companies are making them. Two things I want to point out though is some of them we understand pretty well and have been characterized, some haven't. And we're going to talk way more about this in some future webinars, but there are lots of options. If you want to measure air pollution, you can find something online that will suit your needs. But when I say suit your needs, it will tell you that you can measure PM 2.5, but it's unclear how well a lot of them work. Okay, go to the next slide, Jamie. Okay, and one of the things, and we'll dwell on this in a much greater extent in future webinars, is how well do these sensors work? I think these sensors have to be calibrated. We're still understanding how to calibrate these sensors and how well they hold their calibrations. And again, I think what's going to be critical is being transparent in how these sensors are used, and having a very good idea of the accuracy and precision of these measurements at any given point in time. Can we go to the next slide, Jamie? Oop. And lastly, I just want to say this is a very busy slide, but how about if let's just look at the left plot there. And I just want to tell you that, of course, this is data from a paper I wrote, so I put this in here, but there are increasingly emerging plots like this. This is how well do some of these sensors that we are trying to use work. And on the x-axis is a sort of a federal equivalent reference method. So assume that's kind of like a reference monitor for PM 2.5. And on the y-axis is one of these low-cost sensors. And all I want to say, and this is for very low concentrations, 5 to 20, but they've people have also measured these from 20 to 200 micrograms and 300 micrograms per cubic meter. And if we're really careful and clever and thoughtful, we can actually get these measurements to be within about 10 to 15% of the reference monitor. So if this is true and these calibrations hold with time, I think we have a potentially very powerful way of beginning to make sensor networks and better understand PM 2.5 concentrations at exposure and health outcomes in perhaps very powerful way to do trend analysis as mitigation strategies come into play. I don't want to say, again, we'll talk all about these in the future, and this is a huge area of study and an area that a lot of people are working in, including some of us who are involved with the State Department. Can we go to the next slide, Jamie? So yeah, I would just say, I mentioned this, I won't spend too much time, but the sensors, we have to better understand the calibration of the sensors, how the calibrations change with time, and then we have to figure out a way to constantly implement these calibrations in our sensors to give good information. Can we go to the next slide, Jamie? And lastly, this is the last sort of meat potato slide of my talk. I want to say that this is Beijing on the left, and on the right is the PM 2.5 concentration measured with satellites at a very high resolution. There's emerging methods to look at satellites. I think you can imagine that I think what is really going to happen in the future is we'll merge regulatory monitors with low-cost sensors with satellite measurements to get very high concentration profile fields. This is going to tell us in and around where the high exposures might be. And then we're going to integrate these with meteorological modeling like I showed you. So now that we have these maps, we'll have the regions of that are affecting people in our cities. And I think from this, we're going to get a great picture of air quality exposure and how to really do proper mitigation strategies. And then I think what we're constantly thinking about, and I don't want to say that anybody's come up with a great solution for this, is how can we work with stakeholders in the public and do outreach in a way that gives this information to people that is meaningful. And I think that will be, in future talks, and I think that's something that will be really interesting for us all to talk about. Can we go to the next slide, Jamie? Yeah, so I guess I kind of said that already, but let me conclude by saying, there are a wide range of instruments and methodologies that can be brought to bear to better understand the sources that are responsible for exposure of air pollutants. I think that you have to think carefully about what your objectives are before you choose any given method. And I think that lastly, I think the last bullet here says that it's really important to include quality assurance and quality control plans. And I think what's going to have to happen is that in order to give people confidence that these measurements are worthwhile, we have to have very clear plans for the quality assurance plans. And I think we have to have transparency. And then I think we have to, constantly work with, in this case, stakeholders in the public so that they understand the measurements, they understand their strengths and their limitations, and that we can work together to develop mitigation strategies and really work together to see concentrations in regions decrease and health improve for people who are exposed. So I think I want to stop right there. And thanks, Jamie, for forwarding those, for taking care of the slides. And I think we can take questions.
Thank you, Mike. That's an excellent talk. We have a few questions and I'm going to get organized, but I just want to remind everyone, if you'd like to ask a question, if you go in the Q&A box and type that in, we can address that. But before I go through the questions, I just wanted to see Dr. Salam or Professor Salam, do you have anything that you want to add, or as I'm getting organized with the questions, any comments or perspectives you'd like to share?
Thanks, Jamie. Thanks also Mike Bergin for his excellent presentation. Actually, we need this kind of presentation. We are mostly based on measurement. So we have to look into satellite data, and also the for regulation issue, really we need very sophisticated instruments, especially the region where we are living, the air pollution situation is very bad. So I think my presentation is really helpful and useful for our part. So with this, I'm giving thanks to Mike and also Jim for the organizing the meeting. Thank you.
Thank you. So thank you, Dr. Salam. So the first question, which is in the box, which is a very important question, I'll read to you, and I don't think you can answer it completely, Mike. I think there'll be future webinars about it, but it really is something you address, and I think is a really important point. And I'll just read it. It says, low-cost sensors for air quality monitors are often unstable and easily get affected by atmosphere weather conditions. Also, the cross-sensitivity interfering with different compounds and other issues are a huge challenge. And how can we address that? So that's really that's a big question, but maybe you could begin answering that. And I think that's something we'll be talking about in future webinars.
Yeah, that's a great question. So I guess, to summarize the question, the fact that low-cost sensors are affected by many different atmospheric conditions. And, the way we often think about it is the atmospheric conditions can affect calibrations, and then they can affect the degradation or the drift of the sensor. So I would say this, one thing that I would point out, I think it's important is, and this goes back to the talk, is you want to think it exactly, and the talk goals. So what compound are you trying to measure? And then how well can you measure that, and how well does the calibration stand? And I think what we found, and I'll just be real brief, but I'll say, so the PM 2.5 sensors increasingly, because they've been evaluated in so many different places. There are PM 2.5 sensors. I think we understand pretty well the drift and the calibration issues, but I think, we're not done with that yet. But I think the real problem is for the gas phase sensors, which I think have huge effects, the ambient effects. And so I think that I'm pretty confident that the PM 2.5, that we're going to have these issues figured out and be able to deal with them. But again, you have to always keep these in mind. I'm a little bit less for the gas phase compounds like ozone and NO and NO2 and even CO2. I think that those ambient conditions, I think they're very difficult to get around. And I think lots of people are working on it. Lots of papers are constantly coming out about this, but you're totally right. I think right now, for PM 2.5, I'm a little bit more confident about, but some of the gas phase things are very difficult to measure because of these factors.
Thank you, Mike. And I just want to emphasize again that this is a topic that we'll be talking about preconditioning and, some subtle difference between low cost and medium cost sensors. So this is a really important topic. And I think a major goal of the projects is to demonstrate that we can actually get reasonable data from this. I'm going to go to the next question, Mike. One of the questions is, the next question is, and I think the answer really depends on the goals, but I'll go ahead and ask you and you can answer, and maybe I'll ask Dr. Salam to answer this as well. How many low-cost sensors do you need for a city like Dhaka to capture spatial variability?
Yeah, that is a fantastic question, and that's a question that we've all been asking ourselves who've been in this business for 20 years. I know Jamie and I probably talked about this 20 years ago, and one of the first projects we did together. And I don't have the perfect answer, but I do think it depends, as Jamie said, on the goals. I'll give you an example. Let me give you an example, and then let Salam give his insight about Dhaka. But for example, in New Delhi, India, what we've kind of found very interestingly, so I think a lot of it has to do with the local versus regional effects are on pollution in an area. So for example, the regulatory monitors throughout Delhi, interestingly, agree pretty well with one another. They're not all roadside sites are chosen as background urban sites, but in Delhi, maybe 50 to 70% of the pollution in Delhi is getting blown into Delhi. And so for these regional influence places, seems like you don't really need as many monitors, but if there still are in places like Delhi, there's local hotspots, and I think that there's local spots where exposure could be, is based on maybe small scale industrial areas. And so I don't totally know what the answer is for Dhaka. I'd have to think about it. You could look at, I think what we do more, and I'll say lastly, I think what we do a lot is we look at the population maps in cities, and then we look at where most of the people are, and then we try to place monitors in a place that we think are very exposure relevant and would give concentrations that if we were to do exposure modeling would be mostly representative of where people are. So I don't know the answer for Dhaka. Salam, what do you think? Again, that's a great question. It's something we could debate for a long time, and Jamie knows a lot about this too, and it would be interesting to see what Jamie says.
Yeah, Mike, like you, I also don't know the exact answer how many sensors we need to capture Dhaka city. But for my understanding, we have many local sources as well as we got pollution from outside from Dhaka city. So to capture all of the pollution in Dhaka city, maybe in both cities, we need 30 to 50 sensors. Again, sense.
Dr. Salam broke up a little bit. I think we might.
Administration and academic and residential area inside Daca. It's a kind of mixture, I think, inside Daca. So nobody should don't know the exact number, but definitely we have to measure some parameters. So that in that case, maybe I can assume 15 and 15. South and North Daca city, if we have 30 sensors, we will get the overall impression of Daca city air quality. Thank you.
I would just add to that. I think that there really is there's sort of three components of the air, kind of building on what Mike said. There's a regional effect that goes up and down together. There's micro local sources like vehicles or trash burning or factories. They go up on a regular pattern. And then there's sort of anomalies of things that happen, like maybe a fire or something like that. So I think the idea is, I think we really want to think about breaking it down to those three parts and having a network that addresses the regional, have a network that addresses the the local effects of roadways and cooking and things like that. And then finally, some kind of surveillance that looks at these anomalies. And I think somehow if we put that together, we can do that. So I think on the large scale, it may only be 10 or 15 is enough for a big city. It may be that if we want to capture the roadway stuff, we need another 20 or so. But if we want to look at, the anomalies and individual exposures, we may need hundreds for each individual, or thousands, depending on the interest of that. I'm going to go ahead to the next question. Here's one of the questions. I guess I just want to mention real quick. There's a question about can we provide information about putting together low-cost sensors, and I guess instead of answering that here, we will have a future webinar about configuring and about putting these together, both commercial versus build your own. Mike and also another member of this project, Ross Edwards, are kind of experts in it, and they'll be talking about that in the future. So,
that's a good point.
Real quick question, Mike, maybe you can build on this, what you said before. It says, which air quality parameters and air pollutants can be measured by low-cost sensors?
Yeah, I'll just say, my feeling right now is I feel like we feel pretty good about the PM 2.5 measurements, but the gas phase measurements are more expensive and more complicated, and I'm still not. I'm a little bit nervous about making the gas phase measurements with off-the-shelf measurements, but I would say, and you can. Salam and Jamie, you can weigh in on this. I feel like we feel pretty good about the PM 2.5 measurements, and there's technical papers out there about which sensors to use, and there are some commercially available ones which we kind of like. Again, it's a lot of data. You have to always be cognizant of the fact you have to do QA QC on the data and look it up. But I'm feeling pretty good about PM 2.5 to say that that there's good ways to measure low cost PM 2.5.
Okay, Mike, can you say something a little bit? I'm going to rephrase this question, but it's really about the issue between direct calibration and then coming up with reference factors. And can you say a little bit about the difference between that? The idea that, I think it means like if you calibrate in the laboratory and versus field deployment and trying to manage that. Could you speak a little bit to that question?
Yeah, Jamie put it really interesting. So I think that so our general feeling is you can't make a lab aerosol that is anything like the ambient air. So the notion is that the sensors probably should be calibrated next to a reference monitor. And the way field studies are going on now is you go to a city like Daca, you go put your sensors next to a reference monitor and you get a calibration factor, and then you move them out. But then the idea is that, then you might have pollution on one day, and maybe it's a more dusty day another day, and those calibration factors. I want to say that typically the best way is field calibration, but then there's some emerging techniques that use sort of machine deep learning. I hate to say that, but because everybody's saying that, but there's emerging data analytics techniques where you can constantly reference the monitors against each other and the reference monitors to detect sort of shifts in the calibration and the regional calibration of the aerosols, and you can apply these things. So I think, at the end of the day, I think there's ways to not only initially calibrate instruments, but to watch the calibrations with time and see degradation with time. A combination of initial and intermittent field calibrations, and then data analytics, and as I mentioned, constant referencing to regulatory monitors. So, but again, I'd say the theme of this is that you have to have regulatory monitors that you're using in some way in these regions where you make these low-cost measurements. Does that make sense?
Yes,
Jamie?
thanks, Mike. Thanks,
Yeah.
Mike. There's two questions that are closely related, and I'm going to begin to answer this, but this may be something we try to deal with down the road. They really go about the different sources contributing to PM, and one sort of addresses about the relative health effects by being harmful, and one understands about the spatial variability. And I guess I think it's important to say what we were generalizing before was really about total PM 2.5. I think the idea that if we start thinking about dust versus sulfate versus organics versus black carbon, the spatial variations will be quite different. But we're going to have to think about chemical speciation to address that. And clearly, there's a lot of interest in understanding about apportioning the health effects of different sources. That's probably a little beyond what we'll talk about today. That's something that actually is a big part of my research of understanding about which biological pathways are important for which components. And I don't know that we'll get to that this year, but that's something certainly we can follow up afterwards and share some papers with people. But that is a really important issue and something that I think we want to facilitate further discussion about that. Mike, do you have anything you want to add to that real quick?
Nope, that sounds good.
I don't know if this is a question, maybe, I don't know that I can answer this, and maybe this is something we'll have to come back to in a future webinar, but it's really a question about currently in both Daca and Kolkata, there are low-cost sensor data that's being used. And I guess if there's any comments about the quality of that data, automatic stations versus that. My sense is that I would say and maybe Dr. Salam can answer and Mike, but I think the question is a lot of those were more surveillance type efforts. And I don't think they necessarily, at least to my knowledge where I sit, weren't necessarily designed to include that quality control and quality assurance component. Maybe some of them do, but some of the sort of community-based monitors don't have that. And so it's really hard to understand data quality. And I think one of the important webinars that's coming up next is really this idea of understanding about data quality objectives and developing a quality control and a quality assurance plan. Dr. Salam, do you want to answer that? And then Mike, follow up. Is any other comments?
No, I think you did great. Thank you.
Yeah, I would just note, being involved a lot in this low-cost sensor stuff, some of you might be, there's a company called Purple Air that makes low-cost sensors, and they use the same low-cost sensors for PM that we use. And we've tried to use their data. There's a giant map of data in the US of data that's being reported from these sensors. But even when we go and look at the data in the US from these sensors, we find that a lot of it just doesn't make sense. The data is out there, it's reported on their site, but some of the data looks good, some doesn't. So we have to spend a lot of time QA/QCing it. So I guess the point of the matter is we tend not to use any sensor that we don't know the background of the sensor, and we don't know if we don't know who's running it. And then even in that case, there's still problems. So as Jamie said, there's still a lot of problems using low-cost sensor data that's available because you just don't know the history of the sensor. And I was gonna mention one thing. I'm also looking at the Q&A. So I know Dr. Saha said something. He said something about natural dust and anthropogenic dust, and I think that also one of the things about these calibrations is they're affected by shifts in things like for PM 2.5 shifts in dust versus pollution in the mix, and I think we are beginning to have a way of correct for that. I'm pretty confident, but as you said, the health effects, whether it's regional dust or local dust or something much different, and maybe Jamie, you want to talk a little bit about that, because Jamie is a little bit of an expert in health effects of very specific kinds of components. And so you've got the local dust and you have regional dust, and how does it, what the health effects are of this is that changes that health function, that the global burden of disease uses.
We'll come back to that in future webinars, and we'll follow up by email afterwards. We're capturing all these, but maybe we only have about another 5 minutes or so. So Mike, there's a couple more questions I thought maybe I'd like to present to you. One of them is, could you describe real briefly the principle of operation of the low-cost sensors, and also the likelihood of the prospects for using low-cost sensors for chemical composition of PM, such as ions and trace elements?
Oh boy, so I won't. So the principal operation for PM 2.5 is light scattering, but it's done in a very specific way, and so it's a pretty robust method. It's been going on for a long time. The gas phase sensors tend to be much different for CO2 and CO. It's not dispersive infrared or absorption of infrared energy. And then there's some electrochemical sensors that look more or less at surface reactions. And I think the electrochemical sensors for gases tend not to be as robust for many reasons. But I think that, again, not to go into the details of PM 2.5, which uses light scattering in a very specific way, is a pretty well-established, robust methodology, and we know a lot about it.
Okay, thank you, Mike. I guess there's a few other questions, and they talk a lot about health-related stuff, and I think I'm going to leave those for now, and that's something we'll talk about more in the future with other webinars. I think those are big topics and probably not something we can do justice to. We are getting close to the end, and I guess, Dr. Salam, is there anything else that you want? I know I'm putting you on the spot a little bit. Anything else you would like to add?
I think in the last question, somebody also asked about the chemical composition from sensor. I think normally for PM 2.5, we get the number, not the filter-based thing for chemical composition. So you cannot do chemical composition from the low-cost sensor. We only get the number. So this is the only thing I would like to add.
I would just say, Dr. Salam, that, you know, if you would have asked me 30 years ago, could we have a cell phone? I would say never, right? So I guess I would say, I think I agree with you right now, but I think maybe 20, 30 years from now, maybe there will be technologies that we have that we can see. So I still want to be optimistic for the future, if that's fair.
Yeah, I should have said, and I should have added that right now, just like Jamie said, we can't measure chemical composition low cost, but as Jamie said, you know, it's gonna happen somehow, in ways I hope that we don't even foresee now. That would be really exciting.
Mike, one last question. There's another thing about the laser-based PM 2.5 is the best approach, and I guess I just want to see if there's any doubt or anything else you think competes with the optical properties that we're talking about. Anything you want to add to that real quick?
Yeah, I would just say quickly that there is no low-cost methodology that I can imagine that tends to be better than the light scattering methods for many reasons. There's many people trying different things, but I think right now, we've characterized, and not just me, I mean, collectively, so many people are characterizing these light-based sensors, and it looks like they just work really good. So I don't see anything yet that is intriguing and is going to work any better.
Well, thank you, Mike. I just really want to thank everyone who participated, and I think this is great, and I really look forward to the opportunity to have these webinars in the future. Again, I want to emphasize for those questions that we didn't answer, that maybe were too big of questions, we will follow up with people by email and send you some of our thoughts, and I think some of these we'll address in the future. I just want to let you know, you don't have to write this down, but we have a website that's related to the webinar and the project, and we will be emailing it to everybody who was invited and also everyone who registered. So you'll have access to the video recording of this. It might take us a few days to get that in place. And that we will also answer some of the questions and give information about future webinars. Just as a quick note, we do plan on having the monthly webinars. That'll be the last Tuesday each month at this time. And we will skip April, because of Ramadan, we have a wide range of experts from a wide range of stakeholders that we really look forward to. Finally, I just want to also, I should have said this at the beginning, but I wanted to thank Ross Edwards, who's kind of leading some of the efforts on these projects related to low-cost sensors, and Zane Mao, who's helping behind the scenes, is an undergraduate here at UW-Madison, and James Hermanson, one of our IT specialists, helped us do this. So I really appreciate everyone again. Thank you for your participation, and we certainly will be in touch, and I hope that we can engage more in future webinars going forward. So thank you, Dr. Salam, Daca, Mike, and Zane as well. Thank you again, and we look forward to seeing you in the future. Okay?
Thank you.
Bye-bye.